Welcome back to A Slice of News, where I cut you off a slice of news. Well, suffice to say, the nation's health is in bad hands right now. The Trump-appointed head of the CDC, Susan Monares, was fired from her position after only being there for a few weeks, after she refused to support Health and Human Services Secretary Robert Kennedy's COVID vaccine restrictions. And if that wasn't bad enough, following her ousting, a number of top-level CDC scientists also left, resigning after dire predictions of the future of vaccines in our country under the current administration and the leadership of Secretary Kennedy. So now fewer people can get the vaccine. People who might want it are now unsure if they could even get it using their insurance. In a time where we need strong leadership on the health front, we have ended up with some of the weakest leadership we have had in recent memory. And this is how we get a second pandemic. I'm not saying we will, but only a few years out of a global pandemic, we cannot afford to have such lax health regulations when it has to do with a vaccine for that pandemic. While a new head of the CDC has been named, I think it's safe to say that as a nation we are in danger. The CDC is a vital part of public health. We need to look at this current predicament that we see ourselves in, losing scientists, losing a head of the CDC after only weeks in the position because they refused to bend the knee to Health and Human Services Secretary Kennedy, who knows nothing about public health. I mean, that, I think, is not anything revolutionary to say. The man is incompetent. He knows nothing and speaks nonsense, and is in a high up position that those who know better than him, when they speak out against him, are punished and silenced so that he is not undermined. And that should scare everyone, regardless of which side of the political spectrum you stand on. You don't want to see people who know more silenced in favor of those who know less, or in some cases nothing, about the topic of health. We are going into the time in which flu is going to start cropping up again. New variants of COVID are going to start appearing, and we need to deal with them proactively. We cannot act as if we can restrict who can get the vaccine to a smaller and smaller group and think we're going to be okay. We need leadership that we can all trust and all put our faith in, that we're going to be okay and safe in this upcoming time in which we will see more and more public health concerns. I think we need to really think about what we can expect going forward when it comes to health on a national level. One solution is that certain state governors, such as Governor Pritzker in Illinois, are considering buying up COVID vaccines directly from the manufacturer, leaving it up to the individual states to keep their populace healthy, but leaves the general health of the people in the hands of whether or not their individual state can afford to keep them protected, which is not what you want to see, because you will then have people in states whose governor cannot afford to stockpile vaccines suffering, while those who live in states that can are able to keep their health. Right now we are in a time where public health has been completely undermined by Republicans who don't understand the necessity for public health, it seems, and are willing to see people literally die to make sure that their agendas are maintained. I'm genuinely worried about what we're going to see in the upcoming months once we get into winter and people really start getting sick, if we see just how badly run the CDC is right now. I mean, yes, there's a lot that individual states can do, but they can only do so much. National health, that's part of what we have Health and Human Services for, to oversee all of our health, regardless of what state we live in. And right now, it is being run by a man who is completely unqualified for the position that he's been put in, and he is a danger to public health and a danger to all of us. Republican, Democrat, or anything in between, as long as he is running the head of our national health, we are all in immediate danger because he is hurting public health on a national level. I don't want to predict that we'll have another health emergency like we had a few years ago, but this is how things start. You know, the people who are supposed to be protecting us from upcoming health dangers are being undermined, are being understaffed, are losing their heads, and that's when public health emergencies arise. So I think that we should be concerned. I don't think I would say we're at the panic stage yet, but I definitely think we should see what's happening over at the CDC as deeply concerning and a sign of bad things to come if things continue the way they are. Vaccines are important to public health. Restricting who can and can't get them is not something that's in the public interest. They should be seen as a vital part of public health and available to as many people as possible. Ease of access should be wider, not more restricted. So I want to believe things are going to get better soon, but honestly, I don't know. I don't think anyone knows that this, like so many things, is an ongoing and developing situation, so it's hard to predict where it's going to go. But at this moment, it doesn't look like it's going to go anywhere good, and that is not something we should want to see. Bottom line, the CDC has to be strengthened, not weakened, and it seems clear that under Republican control, it is only weakened. And that is something that will have long-lasting consequences until it is corrected. And hopefully that correction will come very soon. So that is it for this episode. I've been your host, Mr. Slice, and until next time when I cut you off, another slice of news.